people oftentimes say, of course, you're a nurse, you're caring. I'm sorry to disappoint the world. Being a nurse does not guarantee it. Before we are any profession, we're first human beings. And we bring who we are as persons into our professional roles and vice versa. So we, being nurses and educators, although we are more likely to be interested in supporting and caring and compassionate, of course, but it's not a guarantee.
So Jasna, thank you so much for joining me today on the podcast. It's an absolute pleasure to have you, and I'm really excited about this conversation.
Thank you. It's a pleasure to be here, and thank you for inviting me.
So it was quite hard for me to actually kind of get one particular focus to talk to you about today, because there's so many things that I would love to talk to you about. But for our listeners, why don't you start by introducing yourself and where you work and just a little bit about your professional background?
Certainly. So my name is Jasna Schwind. I am an associate professor in the Daphne Cockwell School of Nursing at the Toronto Metropolitan University in Toronto, Canada. In terms of research, I'm a narrative inquirer. I'm interested in human experience and the stories of such experiences. For example, patients' experience of illness or a student's experience of engagement in learning, nurse-patient relationships, how they engage in relational care. As an educator, and that's very much a passion of mine as well, I teach qualitative research, knowledge development in nursing, and advanced therapeutic communication from an interprofessional perspective. So I work with nursing students at undergraduate level and graduate level, as well as other professions, so students from social work, nutrition, child and youth care, early childhood studies, and so on.
Fantastic, thanks. And would you mind just telling us a little bit about your current research interest? So we're going to focus on a particular paper that you published with some co-authors in the past few years, but why don't you just give us a little bit of an outline of what you're currently excited about, what you're currently researching?
Just to give you a bit of a trajectory. So my earlier research really focused on, like I say, the stories of experience. And that moved into looking at students' experience of education. How do they actually engage in teaching and learning contexts? Because the purpose of education, and I really call that teaching learning because it makes it more, for me, more organic and authentic, is how do students engage? What is their experience of that engagement? And so to me, as a teacher, as an educator, it's not good enough just for me to tell the knowledge. How do I engage students so they want to learn? So I do use many creative ways of doing teaching and learning, had to adapt that to the virtual learning that we were engaged in over the last 2 years. But the one for the purposes of our conversation today in terms of self-compassion and mindfulness, I start all of my classes with a brief mindful breathing activity. It's about 4 minutes. And then I end each class with loving kindness meditation. Again, another 4 minutes. At first, I was trepidatious about using this because I started using it about a couple of decades ago. And at that time, it wasn't as common of awareness and knowledge in general public. So I felt a bit uncomfortable, but I thought I'd give it a try. I invited anonymous feedback from students halfway through, and was very positive. So that moved me then to looking at how mindful presence and how being with may impact teaching and learning. So when we decrease our anxiety, when we are present in the moment with one another, we are more able to take the information in, connect it with what we already know, and expand our knowledge. And so that's where my research then moved from experiences of, say, illness, that was my original work, to looking at experience of education, and then more specifically looking at how mindfulness and mindful practices impact educational contexts.
I love this idea of helping to reduce student anxiety and bring them into a state that's more optimized for learning, because I think it's something that we can all kind of resonate with, that how the nerves that we get around certain things that might be challenging for us can impact our ability to learn and take tests and things. And I
Yes.
know there is a research literature, isn't there, which shows that performance can be improved simply by addressing the anxiety
Hmm.
that people experience for different things.
I very much agree. And there's a lot of research now that has come out over the past 20 years, especially that, the empirical research, the randomized control studies, qualitative research that really recognizes the value of managing, and first of all, being aware of our emotions, of our state of mind, and how these impact, again, how we engage with what activity, whatever is happening. And I work very much with metaphors, and so I tell the students, I said, if your mind is closed, like very tight, no water can seep through that, and that is like new knowledge or energy. But if it's more relaxed, energy and knowledge can permeate that, and then you can then use that, like in a planter. If it's a metal planter, well, you can pour lots of water in. After a while it overflows and nothing sticks. But if you have a planter that's porous, you pour the water in, it's absorbed, and you keep on, and knowledge is just coming in and you're integrating it. So using these visuals, I find, and these metaphoric images, students over the years, anecdotally and through research, have said how helpful that is to them to grasp these ideas and then make them theirs. And the idea is to make it your own before it does anything, really.
I love that metaphor, and I can see why that would be really helpful for students as well.
Mm-hmm.
So today's conversation is going to focus on self-compassion, and you've already mentioned just then around a couple of the exercises that you do that are mindfulness and self-compassion exercises with your students. So in terms of the direction of this conversation, in a moment, I'll get you to talk through this recent review article that you and your co-authors have done. And I suppose just to let listeners know, at the moment, Jasna and I have had a conversation before this, and what we thought might be quite a nice idea is we're going to talk about Jasna's paper and some really nice recommendations that her and her co-authors have made around nursing curricula and self-compassion. And at the end, I'm going to lead a brief self-compassion exercise to, I suppose, make it a little bit more tangible, something concrete that people can follow along with and see what self-compassion sounds like, what it feels like. So just to begin with, should we just talk a little bit about what self-compassion is? And I'd just be curious to know, Jasna, for you, I know there's some sort of technical definitions, research in the literature definitions, but what does it mean to you? What's your sort of personal definition of?
Yes. So for me, mindful self-compassion is mindful self-awareness of the mind, body, spirit, and emotion. So this holistic awareness of ourselves, and it's like doing a diagnostic body scan. Um, when we have a car, we take it to the mechanic and we say something's wrong with it. I'm not sure what it is, so they do a diagnostic. So this is what we actually do when we are self-aware. We scan the body, and John Kabat-Zinn did beautiful work with mindful-based stress reduction. Uh, he has a 12-week program, and that is very, very helpful to many people for various reasons. But it's that body scan. We check to see what's going on, and it's not just what we are thinking. Oftentimes that is, but also, are we holding tension, stress in any part of our body? Our emotions, are we feeling frazzled? Are we feeling overly anxious or not? And so on. So really, what we're doing is we're looking to see what is calling our attention. And then we note this. We consider what arises for us. Is it acceptance of this need, or is it the resistance? That's something that we need to ask ourselves. If it's acceptance, then we can breathe into it, we can consider it, reflect on it with care. However, from my experience and having working with myself and with people, a lot of times we tend to lean towards the latter, where we are resistant, and then we become self-critical. And so what we need to do then is to explore this resistance without the judgment. So that what is needed really is the kind curiosity, similar to what we would accord to a dear friend. What is the resistance about? Without judging, without criticism, without beating ourselves up. It's okay. I'm feeling down again. What's going on? Can you tell me about it? Can I maybe write it down? Okay, it'll be fine. Let's support ourselves. So this is what we would do with a friend. Tell me about your feeling down. Did anything happen? What can I do to be there supportive? Maybe breathing a little bit deeper would help, and so on. So this is what we do. So with mindful self-presence, we have the opportunity to start over again. And a longtime practitioner and expert in mindfulness and loving kindness is Sharon Salzberg. She wrote a lovely book on loving kindness in the 90s. And she goes, every minute, every moment is an opportunity to start over. And sometimes, again, many of us have this all or nothing thinking. And so like, oh my gosh, I messed it up. So that's the end. No, this is the moment I messed up. Now is a new moment. Perhaps we can start over again. So to me, mindful self-compassion is this loving kindness to ourselves, and then move on.
That's wonderful. Thanks, Jasna. I find the begin again kind of notion really important and helpful for myself. Sometimes I find myself, I really try to practice self-compassion every day. And I'm not sure whether you've had this experience where I'll find myself being self-critical, and then there's like another layer of self-criticism because I forgot to be self-compassionate. And it's really helpful to remind myself, okay, just begin again. I can start again and be self-compassionate.
But that makes us human.
Yeah.
And again, to me, I've been doing this for many years, and when I teach these workshops on mindfulness and mindful self-compassion to students and colleagues, it's basically allowing ourselves to be who we are without guilt and shame. Chris Germer, who works with Kristen Neff, and the two of them together developed a toolbox of mindful self-compassion, and what the 3 pillars being mindful or present to the moment, and self-kindness, and also the common humanity. So they basically identified these, but I find that when we practice in a kind way to ourselves, that's what we are doing. And what I mentioned, Chris Germer, his work then specifically looked to shame and how shame underlies all of these layers. And, like just what you were saying, I go, oh my gosh, like I've done this for how many, 30 years. Why am I still having a hard time to be present in the moment? It's okay. It just is. And without feeling badly or shamed, or, because we wouldn't shame a friend.
Exactly.
So why do we do that to ourselves,
Yeah. And that links nicely with the exercise we'll be doing later.
Yeah.
So I'm actually curious to know, before we launch into talking about the paper, in your experience, your sort of vast professional experience, can you just tell us a little bit about where you see a lack of self-compassion showing up, perhaps in student nurses? How does that manifest in general?
Oh my gosh, a lot of that. It's a huge topic, in all honesty, because it's connected with perfectionism. We have to be perfect, and in academia, that is very high as one of the big challenges. We want our students to succeed, and grades in academia are a way to show what the student has achieved. However, that can really overshadow the learning. It's like, I just want this grade because I need it if I want to go further in my education, or my family expects it, or whatever. So so that these pressures are increasing on our young people, on all of us, but speaking of our students. And so this societal expectation of success, and then and please don't get me wrong, I think we need all of our wonderful advances in technology and social media and so on. However, I find that over the years, the students' anxiety has risen so high that there are times when I wonder, are they actually learning something?
Mm-hmm.
And so from especially for my graduate students, because they don't have exit exams. So it's how you will demonstrate your education is by what you actually learn, so that you can apply it once you graduate with your master's or your doctorate. But most of the students that in our school that I have been working with are master's students. You will go into your profession and nobody's going to say, did you get an A or an A minus or a B or whatever on your assignment? They're going to know how well you learned is by how you apply it in clinical practice, in your role, whatever that may be. Oftentimes these are leadership roles, they're advanced practice nurses and so on. And so it really is, again, the quality of that learning. And I find the anxiety and these high expectations that, I'll just say society in general, but even, familial and then individual, makes students driven to succeed. And they focus mostly on those grades. And although they are important and we need to have some kind of, measurements and so on, but not when it's out of balance. And so I find that in order for students to be resilient in life, they need to learn how to be, how to actually live the experiences and to learn from these so that they can advance on their life path. It's not just the numbers or the grades. But again, I'm in a different stage of life than they are. They're 18, 19, 20, and I'm imagining I probably was like that too, so I can't, it's not a criticism of them. It's just my desire to help them, to relieve them of the burden of these expectations, I guess.
Would it be okay to talk us through the review article that you might want to mention your co-authors as well, and perhaps just give us a brief summary of why you did the review article, I guess what you are aiming to achieve, and just a little bit of a kind of synopsis of the paper.
Of course, yes. So this article is really inspired by our collective interest in mindful self-compassion and nursing education. So for this article, I worked with Dr. Lisa Ann Hagerman and Dr. Luella Manankel-Rankin. They are my colleagues with whom I collectively work in terms of research as well as writing on this topic. And we wanted to explore self-compassion and its role in supporting well-being, compassionate care, and students' academic success. These are the things that are important for us as nursing professors. And we really wanted to look at the literature, what is out there, what has been written on this particular topic of interest, because what we are trying to do, we are just starting another study where we want to see how we can better support developing, if you will, compassionate leaders. And so that it's not just compassionate care as in a nurse-patient relationship, but compassionate care within themselves, and then compassionate leadership. So so that's why we wanted to do this review, to see what is there. So we wanted to see the compassionate self-care for self and others. Does that come hand in hand, or is that something that one needs to then further develop? And we can talk about that a bit later, but this is just what we were interested in finding out when we were doing the article. But the integrated review really revealed that mindful self-compassion may indeed promote compassionate care towards others, and that it also may support personal well-being and resilience, and further supporting the emotional intelligence, which really strengthens the communication skills, being response able instead of reactive, for example, which is, again, this present moment awareness, where we have a chance for even for a millisecond to stop and say, is my response to this moment, or is it something that's been bothering me about this particular relationship or situation from before? And of course, as educators, we're interested in student academic success. So based on that review and a study that we did before that, where we tried to develop further faculty capacity, or meaning capacity of our educators it was for mindful practices, but mindful self-compassion, so that really we need to bring the experiential into the teaching learning context, so that teachers or educators and students can actually learn through experience. So it's not just speaking about it, because my personal belief is, and I read this example before, and it just made such sense to me again, to say you can't, you can read all you want about swimming, but unless you get wet, you can't learn, you can't swim,
Mm-hmm.
kind of thing. So it's that kind of stuff. We can, we can talk about it, and that's why I love the idea that at the end, you will be guiding us through an exercise, so that the audience may actually experience what it may feel like, because we can talk about it, may be of interest, we hope it is of interest to people, but actually experiencing it makes that difference. And of course, so this experiential piece is very important.
Absolutely. So thanks for giving us that summary. So I suppose you mentioned that you were looking at that relationship between self-compassion, that kindness towards ourselves, our ability to be compassionate towards other people, and obviously that's important in nursing and healthcare, isn't it?
Yes.
And then you looked at the influence self-compassion had on student learning, that it
Yes.
helped optimized, improved the actual learning experience of the nursing students, and then looking at the specific experiential work that you could do, that you could embed into the curricula. I guess should we just dig into those a little bit more?
Yes.
So with the self-compassion and compassionate care, I mean, I think it makes completely intuitive sense, doesn't it, that if we are able to be kind with ourselves, we're able to be acknowledge our own emotional states, we're able to kind of coach ourselves to do our best but in a non kind of shaming, critical way. It's going to get us into a state that is better for being the caregivers that we want to be, isn't it?
Yes.
And is that your personal experience, and is that what you found from this review?
Indeed, yes. And this review really supported what we were experiencing ourselves, and from our personal work with our students, but also the research that we started to develop further. And so we were heartened by the fact that that other colleagues and researchers have come across, have found similar perspectives and ideas. See, because when we are present with ourselves, we start. I have to just a side note. Sometimes people say I'm very compassionate towards others, but when it comes to myself, I'm not. And so I personally wanted to think more about, so what is it? Is it, do I have to be mindful with myself before I can be, compassionate with myself before I can be compassionate with others? That was interesting. And that, for me, I thought, oh, tension. What is it? And further reflection and work with participants, with colleagues, and so on, I have come to recognize that and that we cannot authentically give what we do not have. And so, based on that, I feel that we first really must be kind to ourselves before we can extend that kindness to others, because we need to know what that kindness is. And we need to be responsible to the person in our care, because it's not, when I first started doing this, and people oftentimes say, of course, you're a nurse, you're caring. I'm sorry to disappoint the world. Being a nurse does not guarantee it. It is before we are any profession, we're first human beings, and we bring all who we are as persons into our professional roles and vice versa. So we being nurses and educators, although we are more likely to be interested in supporting and caring and compassionate, of course, but it's not a guarantee. And so we can learn allopathically what compassion is, what caring is, just disconnected from books and textbooks and stuff. Very important. But until we experience it ourselves, it's not authentic, because not everybody needs to be asked the question, so how is your dog? To go beyond the actual disease process of a person. Somebody may be interested, saying, you know what, I understand you have you were just told they have a serious illness. Is there somebody at home that can look after your dog? That may be important to that person, but not necessarily to everybody who was diagnosed with a serious illness. So this is this thing of being responsible. And Louise Hay was a writer and worked very much on the mind and body and spirit connection. And she would say, we have to be responsible, and that's what mindful presence allows us to do. And when we are present in that way with ourselves, then we know what that feels like, and so that we can then also offer it to others. So when we have that kindness and presence of mind, then we can then genuinely, authentically do that, not just by the book, which becomes very mechanistic. And then we get the pat answers, which are actually more harmful. Don't worry, everything is going to be fine. Maybe for one person, yes, but for somebody else, that may not be the case. So anyhow, so it really is this presence with and connection with one another on a human level. And that's where my work is very informs this work. And mindfulness is the humanness of care, that we connect on a human level.
So important.
Yeah.
I think something encouraging for, if there are listeners out there who are listening to this thinking, yeah, I find it really much easier to be compassionate towards others than compassionate towards myself. You're not the only person, and that is definitely found in the research literature, and I'm sure we all know people like that. I was certainly like that until I started working on self-compassion. But the good news is that there are lots of tools that we can use. It's a skill set, isn't it, that we can be trained in, and there are some blocks and barriers to being self-compassionate sometimes, but we know quite a bit about those, and those can be overcome as well. So let's move on to talking about self-compassion and student learning then. I think this is a really interesting research literature, because I think sometimes people have misconceptions about self-compassion. There are some myths about self-compassion or misgivings, that self-compassion sometimes is equated with self-indulgence, that if I'm going to be self-compassionate, I'm going to be kind and loving to myself. How am I going to perform? How am I going to do well if I'm just giving myself self-love all the time? And I think your summary of how self-compassion can actually improve student learning addresses some of that. So do you want to just talk through a few of the kind of sort of findings that you came up with?
Well, for example, you mentioned how mindful self-compassion, people will say, well, so if I'm kind to myself and, well, I feel feel down, so I want to be kind to myself, and I will go and have some chocolate cookies, for example. Am I being kind to myself? Good question.
Mhm.
So the way we want to differentiate being kind to ourselves is, what is the long-term benefit? What is the long view? I may be falsely, but and I don't want to say falsely, because there's a time and place where, you know what, things are happening, and I just need to have a chocolate cookie. There's nothing wrong with it. There's no need to shame. But if it is something that we default to mindlessly, oh, I'm tired, cookies. Oh, I'm stressed, cookies. That's not being kind. That's being disembodied. That's being disconnected. And that's harmful. What is kind is to say, I'm recognize that I'm very tired, or I'm stressed, or I'm anxious. I recognize that I am craving sugar, not cookies, but sugar, to boost my energy. What else could I do to do that? And so on. And so this is, so again, it's that having that space by being present and by being lovingly, that the word tough love somehow seems like, but being caring enough to ourselves so we don't harm ourselves. That's the difference.
Mhm.
And so kindness, again, like, for example, I'm thinking many years ago, I was a critical care nurse. And so the patient would come in emergency room, a patient would come in with a wound, and I would have to perhaps pull off a dressing that was stuck to the wound. Well, I will do that compassionately, but I sometimes have to pull that off. That's more caring than leaving it on and letting it fester. Do you know what I mean?
Yeah.
So oh, she was kind, she never removed the dressing. No, she was not doing her job. In order to care for this patient with kindness and knowledge, I need to remove that dressing so that we can debride the air, the wound, and then dress it properly so it can heal. So it's really so when we talk about mindful self-compassion, we're not throwing the brain out the window. It has to be intelligent. It has to be holistic, integrated, mind, body, spirit, and emotion, so that all of these pieces play into the situation, whatever that may be. So when I talk to the students, again, being kind to themselves, maybe they have 3 or 4 papers that are assignments that are due, within the same week at the end of the term or something. So what may be the kindest thing to do? Organize and prioritize. These are skills that also students learn. And then realistically focus on one and get that completed, because we know studies have shown that if we go from task to task with task, it's like trains when they switch tracks. It takes a moment for it to click from one track to another. So it's the brain blink. That is the scientific term that has been identified. Even if it's a millisecond, it helps us, it prevents us from focusing and staying on track with one thing. So that is a kindness that we extend to ourselves. And if we say, and then we say, I need to spend time talking with a friend, allow that to be able to feed the soul, so to speak, for a period, but give it a finite time so that it does not eat away at your other work. So it's this sense of, I would say, presence, maturity, as some will call it. That's kindness. That's being kind to ourselves, where we don't, where we proceed, but gently and caringly. Yeah,
Yeah,
that's what comes to my mind. Yeah.
that's certainly my experience. And I think, as we know from the research literature as well, like that when we're being self-compassionate, we're being motivating, aren't we? We're using it to motivate ourselves with kindness rather than criticism, which we actually know does not impact your ability to set goals and achieve goals. In fact,
That's
it's the
correct.
opposite. It actually helps you to be more focused, and it actually helps students to come back from setbacks quicker. It
Yes.
helps them to be more willing and open to receive feedback from their tutors or other people, perhaps on their placements, because you know that if you do something wrong or you make a mistake, you've got your own back, haven't you? You're able to respond with kindness, acknowledge the sort of the things that you might have done well as the things you didn't do so well, and then move forward with an action plan. And I think that's something about self-compassion that I think sometimes people don't get, is that they think, because people have been understandably have habitually used that self-criticism, being hard on themselves to perform. And you know what, it does work, doesn't it? It works to a certain extent, but at what cost? It can make you feel more anxious and stressed. But the alternative is self-compassion, which allows you to do all those things but
Yeah.
actually feel good about yourself at the same
Yeah.
time.
Yes. Yes. And if I may add here, is that when we role model that to our students, then it becomes normalized, and they can see that if they are treated with kindness, chances are much higher they will extend that kindness to people in their care,
Mm-hmm.
and to themselves and to others. And so it really is spreading the wave of positivity, if you will, as opposed to a lot of times we will hear, well, when I was in such and such school grade, my teacher did, was very screaming and hard on me and so on. And so they think that when they get to be teachers, not that they're trying to be mean, it's just that that's the only thing that was role model to them, to all of us. So it's not them and us, it's just we were once there in school. But when we are treated with care and compassion, then chances are much higher they will treat themselves like that, their families, their people in their care, if they're in nursing or whatever profession they are in teaching, or and so on. So it does multiply. It's a good wave.
Absolutely. So I'm mindful of time, and I don't want to.
Yes.
Obviously, I know you're going to have other things to do later, Jasna. Would it be great, before we move on to do this exercise, why don't you tell us about the recommendations that came out of this review? Because I think they're fantastic, and it was so funny when I came across your paper, because it coincided so much with the work that I am doing over here in the UK, which is basically to try and push for this, to embed self-compassion work into nursing education and curricula. So just talk us through what your recommendations are.
So what we really, our goal is really to integrate mindful self-compassion into nursing curricula from day one, and ensure its skills are threaded through all courses. But before we can do that, we really need to build what we call faculty capacity, or capacity of teachers, tutors, educators, different terms that we use. Um, they need to learn these skills themselves, because not everyone is comfortable or skilled in engaging in mindful practices. And so I think that is very, very important. And we could also engage students in artful activities like creative reflection, and and um, and engage and reflective dialogues with one another, because we need to award the same recognition to mindful self-compassion skills as we do to other scholarly endeavors. So we as educators need to then demonstrate respect for the development of future I use the metaphor self as instrument of care. So we need to develop our future instruments of care to be fine-tuned, to function at their highest possible ability, and that can be through uh, scholarly readings, research, of course, but importantly, to bring the academic work and the experiential that they are together, form as one, that they inform one another. And so it is normalized. So it's not like, well, this teacher uses mindful practices and this one doesn't,
Mm.
or this one is nice, but this one is not, you know. So to really have it as part of curriculum. And that process takes a little bit of work, because curricula, as you know, are take time to develop, and it's a process in different places, you know, that has to be followed. But we have to start somewhere. And so that's the biggest recommendation is for us, is to bring the academic, the textbook stuff with the experiential and start in day one. But also the faculty, educators need to be versed in this as well.
I totally agree. I think there's that trickle down effect that's necessary, and
Yeah.
like you say, it's a kind of philosophy, isn't it? Rather than it's just,
Yes.
here's a module, here's something that you can just take, and it's just a one-off thing.
Yes.
Yeah, that's great. So what we'll do, Jasna, is we'll put a link to your article in the show notes of this podcast, and
Okay.
people can access that and have a read for themselves. There may be nurse educators out there, or people from universities or nursing students who would like to have a look at the article and those recommendations. So shall we move on to this exercise to finish off with?
Thank you. Yes, please.
Great. So in this exercise, we're going to just be giving you a little bit of a taster of what it's like to experience self-compassion. So of course, if you're listening to this whilst driving, you may not want to close your eyes or follow along. I'm going to invite you, if you'd like to close your eyes. It can help people focus sometimes. And we're just going to settle ourselves to begin with a couple of slightly deeper breaths in through the nose and out through the mouth. And I just want you to bring to mind a recent experience that you've had where perhaps you were being a little bit hard on yourself. You noticed maybe some negative self-talk, perhaps something had gone wrong. And I want you to think about an experience. If we had a rating of 1 to 10, where 10 was a really quite intense event or experience for you, and 1 was really kind of like minor, we're going for like a 2 or a 3 on this scale. So thinking about a time where you're hard on yourself, perhaps putting pressure on yourself, and just want you to bring to mind the particular words that were being used in your mind and the tonality of that inner self-talk. And as you do that, just notice how your body feels as you sort of replay that. The first thing I'm going to get you to do is, with a genuine sense of curiosity, is just to ask yourself, would I speak to a friend or someone important to me in the way that I've been speaking to myself in my mind? Just notice whatever shows up. And now what I'm going to ask you to do is imagine a friend, someone close to you, it could be a family member, someone important to you. Imagine they've been through a very similar situation. Perhaps they made a mistake. They failed an exam. There was something going on that was hard for them. And I want you to just picture them in your mind. Picture their face, the way they look as they're struggling. Really see if you can imagine that in your mind's eye. And I want you to imagine the kinds of words and gestures you might use to show compassion towards that person. What might you say to them in that moment of struggling or suffering? Might you put an arm around them to comfort them? Really imagine the tone of voice that you would use as you did that. And really notice what that feels like in your body as you imagine expressing this compassion and understanding, caring, kindness towards a friend. So now I'm going to invite you to do something a little bit different. And I want you for a moment now to see if you can extend that same sense of compassion towards yourself. So bringing to mind again this situation that happened lately where you were being hard on yourself or being self-critical. And I just want you to use those same words, imagining the kind of gesture that you did with your friend and offering that to yourself in this moment. A good question to ask ourselves is, what do I most need right now? Or what did I most need in that moment? What did I need to hear or feel? And notice what that feels like to offer yourself that genuine expression of kindness and support and comfort. Sometimes it can be difficult. Maybe you surprised yourself. Just note whatever showed up for you. And just to finish this exercise, I'm just going to invite you to practice that. Perhaps going through the rest of today, whatever's going on for you. Maybe there's quite a lot of pressure at work or your studies. And see if you can try to summon up that same kind, motivating voice. Okay, let's finish the exercise there. Jasna, do you mind sharing just a little reflection at all about how you found that? What showed up for you?
That was absolutely lovely. Thank you. And when I imagined a stressful situation where I felt I wanted to be critical about what I was going through, and you said, how would you talk to a friend like that? And I wouldn't. And what would I say to the friend? I would, touch their arm in a caring way, and I would say, it's okay. You're doing the best you can. And this is and I went on and support him. And that came so readily to me, as we talked earlier, this sense of, wanting to be caring and supporting to others. And then, but doing that, turning that then towards me, I felt relaxed. I felt like the energy just eased off. Whereas when I first imagined or recalled the situation, I had tension in my epigastric area and the stomach area. And I felt a bit stiff in the body. And then I just felt this melting of tension, and the muscles are relaxing. So thank you. That was beautiful. That was very helpful.
No problem. If anyone listening would like to access that exercise, then you can visit our YouTube channel, where I'll make sure there's an upload of that, and there's going to be some other exercises. It's Nurse Wellbeing Mission on YouTube. Jasna, just to finish the conversation today, with all of your vast and wonderful experience, what's your advice you would like to share, perhaps to maybe just to nurses who are starting their training, or just nursing colleagues in general? Can you share some wisdom or one piece of advice you'd like to give people?
A couple of things. The first thing is to be gentle. Be gentle with yourself. Or I'd like to speak in we need to be gentle with ourselves, all of us. And keeping in mind that every moment is an opportunity to start over again. Very important. And that doing one workshop or one listening to one podcast or YouTube, that's beautiful, but it's not the practice itself. Mm-hmm. It's a way of life. It does not mean that everything is going to be peachy, beautiful. It just means that we will live our life. We will taste it. We will live it. We will enjoy it more because we are living it. So gentle, and it's a way of life. So just that would be my overall, but I could talk for much longer than that.
Well, I'm going to get you back on.
Thank you.
There's so much that we could talk about. I think we've got so much overlap, haven't we, in what we're interested in and what we practice in our own lives.
Yes, indeed. Well. Yes.
So I just want to thank you enormously for your time today and for the work that you're doing. It's really inspired me, and I love reading your research. So thank you.
Thank you so much, Nathan. Such a pleasure to speak with you. Thank you.